I'm Marilyn Priel. On this program of The Better Part, we will be discussing new procedures for treating mental illnesses. According to the Substance Abuse and Mental Health Administration, about 42.5 million adults in the United States suffer from mental health problems. No one is exempt. Even our greatest artists and intellects are not immune. Throughout history, we've been aware of mental illness. Medical science has searched for a cure with limited success. At first, the treatments were crude. By the early 20th century, we were treating mental disorders with psychotherapy and having limited success. Then drugs were introduced. They brought relief to some, but it came at a high price. There were often debilitating side effects. Now, with the introduction of technology, comes a new approach to medicine and mental health. A partnership between technology and medical science is leading to amazing new treatments. This alliance has produced new discoveries and new tools. For this program, we will discuss some of the advances for treating mood disorders. We are on the threshold of a new era, and newer treatments are already being implemented. If you or someone you know is suffering from depression or other mental health problems, there is hope. Ask yourself, am I ready for the rest of my life? Neuropsychiatrist Dr. Saad Shakir is trained in many areas of medicine. He is founder and chief officer of Silicon Valley TMS with 5 offices in the Bay Area. He has brought with him a guest and patient, Tracy Shintaku, who has experienced good results from new innovative treatments. Welcome to you both.
Thank you.
Thank you. Pleasure to be here, and Happy New Year.
Thank you. Dr. Shakir, can you tell us about the latest innovations in mental health care?
Since I've been a physician, it's really grown 1,000%, and a lot of it is based on the technology. Technology has advanced so much. Now we can see pathways in the brain. Even there's research on listening to synapses, one of the billions of synapses in the brain. We know how moods are regulated. So the neuroscience is really full of new technology, diagnostically and therapeutically. A long ways from the 1950s, where shock therapy and psychoanalysis was prevalent. Now we have, in the past 2 decades, amazing technologies and newer innovations, which I'm excited to share with you. We still sit on the couch and talk, but we have amazing new tools in addition. A good history is still important. Physical exam, medical testing. Occasionally we do brain mapping. Brain mapping is really important when we want to navigate and use non-invasive technology, as I'll be talking about with TMS, to know the exact area we want to treat that controls mood and anxiety. So we use whatever is evidence-based that will help us in the most cost-effective way to make a diagnosis when necessary. We don't do that with every patient. We treat people with refractory mood or neuropsychiatric disorders. We do all of that. We also have genetic testing to find what are appropriate medications based on a DNA sample. We take personalized medicine that tells us how the person inherited what genes and which medication is appropriate. A long ways from what I call a target shooting strategy, where you use the drug of the month in the past. No more. We have very much personalized medicine and newer technologies these days. It's exciting.
Tell us a bit about the new techniques, mainly transcranial magnetic stimulation.
I will probably best describe it in a few minutes, how I got into it. So I'm trained in medicine, neurology, and psychiatry. So I've always been looking at newer technology that's usable to help improve patient care. So in the late 1990s, early 2000, Stanford was one of the sites of the trial for transcranial magnetic stimulation. And through my affiliation, I found out about the study. And one of my private patients was in the study. This is the first pivotal study that the FDA did that involved 301 patients. And this young woman had been depressed for years and years, and I followed her for a couple of years. And in 6 weeks of daily treatment, she was a new person. I said, oh my God, this is not the magnetic use for arthritis, this is real. So this was in 2000, early 2000. Canada approved it sooner than the US, and I was following the Canadian story. And then in the US, it took 6 more years of studies, and it got approved in 2008.
Can you describe how it works?
So basically, it's based on the technology that focuses, there's an area of the brain, and I brought the brain with me here to show you. We do the mapping by localizing the motor cortex of the brain, which roughly would be here, 5.5 centimeters in front of that area, which is roughly here, is an area about the size of a golf ball that's 2 to 3 centimeters deep. I call that area Grand Central Station of Mood Anxiety Control. So this is the area we localize, and when the patient comes into treatment, we use a high-power magnet. They're watching TV, relaxing, while we're stimulating the brain in that area. And it's amazing. We can activate the underactive areas of the brain and rebalance the magnetic and electrical currents in the brain that are responsible for mood, anxiety, sleep, executive function, and many other future studies that are happening now.
If you have a patient who suffers from agitated depression, how would you locate and stimulate the correct area of the brain?
That area connects with the whole third of the brain, that the prefrontal cortex, and it regulates anxiety, depression, and they talk to each other through billions of synapses. And if you see color scan of the brain, which I'll be glad to share with you, you see that the blue areas are underactive, and these are the depression area. There is one area called the cingulate area of the brain that is red hot and red, literally red on color scan of the brain. That area calms down with the TMS. So that tones down, the blue areas activate. A lot of people with anxiety and depression are more distressed by anxiety oftentimes, and says, well, I really don't have depression, I have anxiety. But when we do the evaluation and we recognize it's the same area of the brain, we actually, it's amazing, it works on both cluster of symptoms as well as others which we don't advertise, you know, but sleep improves, cognitive functioning, executive operation, clarity. A lot of patients say, gee, the cloud is lifted, I can think clearly, I can do more math, etc. So we regulate that area without the shotgun effect of medication. Because even though we have powerful medication, but when you take a medication orally, it goes all over. And sometimes it goes to areas of the brain that it causes more side effects than benefits, which is what affects compliance. TMS, you go to that area, and I wouldn't call it zapping. A lot of people say, oh, is this the new shock therapy? I want to be very clear to the audience.
No.
It is the opposite of shock therapy because we do it with an alive, conscious patient, no anesthesia, no seizure. We stimulate with this high-power MRI magnet those pathways in the brain without making them unconscious and with minimum side effects. Less than 5% of people in the trials have some pain because we stimulate with this magnet on the skin, but a lot of times with medications you get more of the side effects and less of the benefit because we don't have control over which area we want to stimulate. So if anybody is now getting perfect results with their medication and or if they're having tolerability issues with medications, they really should consider the newer treatments we have.
Is this TMS helpful for treating ADD and ADHD?
I want to be very careful to say the FDA in the United States has it approved for depression. However, there are many studies now on an experimental basis for many other neuropsychiatric conditions. ADHD is one of them. But most of the studies with ADHD show a different area of the brain. So we know more about the brain now. The area I showed you, ADHD, is the right prefrontal cortex, and it's underactive because of diminished dopamine. So this is experimental, not FDA approved. But if we use a low level of stimulation on the right prefrontal area, evidence shows that it might help with focus and concentration. There are studies on pain, autism spectrum. Recently there has been a wonderful book by a New York bestseller. John Elder Robison is the author, and the title of the book is Switched On. He is a person who has Asperger's, and he went through a trial at Harvard with a friend of mine who's the head of the neuromodulation there, and his life is different. He has more empathy, more interpersonal. So the technology is very promising for the coming decade or two for other indications, and the research is on, so stay tuned of all the wonderful things we're discovering.
Are any studies being conducted on autism in this treatment?
There are some centers in Europe and in the US that are using it as a primary treatment for autism spectrum. Now that you've asked, we've had several people we've had tremendous success with. For the neurobehavioral parts, like we've had people with socialization anxiety, poor intercommunication, poor communication skills, where we have improved it with TMS. But as I said, I mean, I want to make sure that people know this is not the mainstream treatment yet for autism, but it can improve behaviors. I have many wonderful stories I can tell you if you want me to elaborate, of people who were going to be institutionalized and became more functional and were able to go to regular high schools. But at this point, it's amazing for depression and anxiety, and we're looking at other areas.
Can Tourette syndrome, commonly known as tics, be helped with this treatment?
The tic is a deeper area of the brain.
Tourette's.
So one of the devices, we have two sets of devices now. We have the surface TMS and we have deep TMS. The deep TMS is produced by a company called Brainsway, and the coil penetrates 5 to 6 centimeters. So they're doing studies now with that for movement disorders, including tics, Parkinson.
Which is Tourette's.
Tourette's,
yeah.
Parkinson disorder, essential tremor, and OCD, obsessive compulsive disorders. But as I said, it's not yet ready for prime time in terms of mainstream treatment, but experimentally it looks very promising.
Please explain the difference between Brainsway and the NeuroStar treatment.
The technology, so it's the same theory behind it. The magnet is different. A NeuroStar is called a figure-8 magnet. It's like a handcuffing over the head in the area I showed you. The Brainsway is more like a football helmet that goes down to this area, and that's called deep TMS. The coil in that is called H1 coil because it goes deeper and both sides of the brain. And there's research on other coils. So in the coming decade, I suspect there's going to be a bunch of new indications and technologies along TMS as a non-invasive treatment.
Can depression brought on by hormonal imbalance be treated by TMS?
Our approach in our clinic, we have, by the way, an integrated multidiscipline clinic. We have psychologists, counselors, nurses, we have nutritionists, we have doctors, mid-level provider. We evaluate the person for what they're coming for. We often see women who have mood issues around menopause, perimenopause, pregnancy, postpartum. So our intervention can include whatever technology that applies. But we're really excited about TMS, particularly because in pregnancy and postpartum, we want to minimize systemic exposure to medications. So we've had some success in using TMS technology in pregnancy and in postpartum.
Well, let's turn our attention to Tracy. Tracy, tell us about yourself.
I've been in high tech for 36 years and very high stress, very interested in data and how things work. Since I've had TMS, I've actually become very active in artwork, which I'd never been part of before. But primarily I work, and up until pretty recently, I've just absolutely loved my job. I mean, I gave my whole self to my job because I loved what I did, and I got to help people my way. You know, I did consulting for 10 years, and I just always felt like I was a part of everything and really enjoyed it.
Did TMS bring out those artistic abilities in you?
Well, I don't know if they're really, if other people would consider them to be artistic abilities.
You should show them the gift you gave me.
But I have enjoyed it. But there's always the technology bent in everything I do. I mean, that's my job, and that's the world I live in. And even with the medical work that we did, or that Dr. Shakir did with me, part of me finding him had to do with the technology that he had available.
Actually, what brought you then to Dr. Shakir?
So I have an arrangement with my primary care doctor, and she knows my history, and I have done some research. I have a history of 4 strokes, which I never really worked on appropriately. I just knew I was to stay away from estrogen. And I was going into menopause, and I needed some help. How do I get through this? And she actually recommended Dr. Shakir. She's very involved with Stanford, and she knew about the work that Dr. Shakir had done. And he's world-renowned, actually, for what he does. And so I had been working a little bit with the Amen clinics and had the brain scans done there, and I worked with my primary care, and her name is Dr. Archana Dubey, and I have to give her a plug because she's fantastic. But she actually sat down with me and helped me figure out a plan. You know, let's try these things, let's try those things. And when I came to meet with Dr. Shakir, he read everything. We gave him all this data, and he actually looked at me as a whole person and worked with me to actually put together what was going to be the right treatment to give me the best results. And I can't say thank you enough, because I went from really being in the dark and being very sad and anxious to being extremely happy, bubbly. I felt like myself again in, 30 days?
Absolutely.
So,
Oh my goodness.
and I had tried every kind of medication.
So you
imagine.
had the TMS treatment then?
I had the deep tissue, or the deep
TMS.
Deep TMS.
What sensations do you have during your treatment?
I was actually a little bit nervous about it to begin with, because I'm claustrophobic. I don't like the MRIs, and they make me cry. And so this was much smaller. It was actually kind of nice, because they put the helmet on, and Dr. Shakir came in with the technician, and they actually adjusted it. When you start aiming magnets into your brain, if you get the wrong little spot, you're going to start having yeah. And so they were really good about setting it just right, and we actually recalibrated it once along the way. And the only thing I would advise to people is bring something to chew on, to bite or hold your mouth still, a mouth guard, or in my case I use the earplugs. Make sure you wear your earplugs, and bring something to do. And for me, they were 20-minute sessions, so I was there like 30 minutes, and I would do artwork. Right, I'd play with my iPad
while you're in the procedure.
Yes.
I see.
Some people read books. Some people play games on their phone.
Or talk.
Your head is in this position with the deep TMS.
So you can't move. You shouldn't move. I mean, you shouldn't move your head.
Yeah, but you can move your eyes. And
yeah, it's strapped on.
And you hear noise then?
You hear the clicking noise and the tapping.
How often do you have a treatment?
You pretty much do it on a daily basis for 3 weeks, and then you taper it off. So total, it's 30 sessions spread out over, I think, 5 or 6 weeks we did.
And does this complete the entire treatment, or do you ever have to go back?
So about 40% of our patients who have success with TMS will need some booster at a future point. 60% have not needed any and continue to do well. And those who do need booster, we advise them. We try to follow up after the treatment, monthly or every 2 months, to make sure it's holding. If there's any indication of a setback, and we do rating scales weekly to make sure if there's even a slippage, 10%, we jump at it. And not just with TMS. As Tracy mentioned, we have counselors, psychology, cognitive therapy. We counsel on exercise, lifestyle. TMS clears the depression, But a lot of people with depression live in a cave for a long time. So sometimes the challenge is to get them to change new habits, to learn to smell the flowers and enjoy the sunshine and things they haven't done for a while.
I should have asked you, can schizophrenia be treated with TMS?
Not at this point, except one type called schizoaffective, where there's a significant depression component. We've treated the depressive phase. But to modify schizophrenia, it's not mainstream yet. There are some trials for visual and auditory hallucinations, but it's not yet FDA approved. As I said, the brain is an amazing organ. Once we figure out every aspect of the brain, we're going to be able to stimulate it or tone it down appropriately with non-invasive technology.
And our brains change every day, right? The chemicals, restructuring what we do, and kind of like the full scheme of lifestyle can impact your brain health, whether it's exercise, nutrition, meditation. So if you are able to adapt all those things to keep your brain clean, if you will, after you have the TMS cleaning done, bring in a housekeeper.
Yeah.
Right?
One thing I wanted to mention, because it often comes up, is how about medications if somebody is on medications? So when we do TMS, if you're on medication, we don't have to change anything, at least until we finish the course of TMS. And again, I'll give you our experience now, many hundreds of patients we treated. I'd say 1/3 of our patients who've successfully been treated are off medications completely. Another third are on much less medications. On our website, there's a school teacher who says 2 years after TMS, she is on half a dose of one medication when she was on 5 medications before, and she's 1,000% better. And the third are those who are on like 1 or 2 medications and were stuck, and now they're functional. So TMS acts as a booster to get them out of the stuckness they were. So there is no right or wrong. Some people do need medication, but a lot of patients can lessen the amount or eliminate them altogether in about 30 to 40%.
Could you discuss another treatment that's ketamine injections that's supposed to be helpful for the depression?
In our quest to really not have any obstacles to treat patients, now we have a new treatment that's not yet FDA approved called ketamine infusion therapy. Ketamine has been around as an anesthetic and has been used in pain conditions. But there are some amazing studies in depression, in the acute treatment of depression. One of my new doctors in the group was running a program in a university setting for ketamine with amazing success rate, 70%. We opened a ketamine clinic in July, and now our success is 80%. With amazing. So we use it as another tool, and it involves, we have an infusion nurse, we have an infusion center in our San Jose office.
So that would be intravenous?
Yes, we do intravenous. It's 3 infusions the first week, and somebody has to drive them in. They're in for about 40 minutes, and then the second week 3 infusions, and you're done. However, we found out that people will need maybe a booster infusion every 3 to 4 weeks after the acute course. But it's been miraculous success for severe depression. And we position that after TMS, because TMS is FDA approved, but we don't give up. If we don't really, with TMS we've had 86% success rates, but those 14% who have not gotten well, they've gotten better maybe, but not well. We have 3 people now. We combine deep TMS with infusion, and life can't be better with them, so we're happy. You know, I have to share this with you, if I may. The day that Robin Williams killed himself, I was in my San Francisco office, and my associate said Robin Williams, it was a Monday afternoon, killed himself. And we knew in the news that he had been depressed. My first reaction, and he lives in Marin, my first reaction is, why didn't they send him to us? And he had been in mental health and chemical treatment. I wish I could have treated him, this genius of a comedian, who obviously had, had Parkinson, depression. We could have treated him with TMS.
Well, thank you both so much for coming and being on our program. It's been wonderful having you and so beneficial to many people. Thanks again.
Well, thank you for the opportunity to speak to you and your audience. And I tell you, I'm in this to get people well as much as we can. So hopefully everybody who has felt hopeless or depressed, please don't give up.
Hi, I'm Michelle. I've recently been doing the TMS treatment. At first, I was extremely depressed. It was very debilitating for me. I had no personality, I had no life, I couldn't function or do my daily activities. I didn't get pleasure in doing anything. I've been suffering from depression, severe depression, on and off for about 9 years now. It was so frustrating to have psychiatrists try to prescribe me different medications and telling me, oh, it might take 4 to 6 weeks to work, if it even works. It's like I had no hope. The fact that I didn't know when I would snap out of my depression was just horrible, to wake up every day just feeling very down, not being able to get out of bed. I couldn't function at all. I just had no quality of life. It was really hard. When I was in the depressive episode, that I didn't think that we could have kids, because I can't even take care of myself when I get like that, let alone take care of another human being. Finally, I looked into alternative medicines and I found out about TMS. So I decided to try it, and literally I just go in there for 37.5 minutes and I just watch Netflix. There's a technician in there with me, that's it. And it's just a tapping on the left side of my brain, and I had no pain or anything. I have more energy than I've ever felt. I would get up, work out, go to my TMS treatment, then grab lunch with a friend. I'm so productive. I've never been so clear about anything or had this much energy. The fact that I don't have to be on medication. I've already started decreasing my medication since I finished it, and no different. I still feel amazing. And I'll be off medications completely in a few weeks, and I couldn't be happier. I'm so excited about my future and just about getting the word out there to other people. I just want to help as many people as I can by telling them that this amazing treatment is out there.
We're happy you joined us for this important program, and we look forward to having you again next time. Goodbye for now. For additional information, we suggest you check out this following website, and we recommend reading on mental health subjects with the following books.